Hello, and welcome back. In this video, we'll talk about an autoimmune condition called systemic lupus erythematosus, also known as lupus. In autoimmune diseases, the immune system, which is responsible for protecting the body from harmful organisms, incorrectly attacks healthy tissues. Lupus can inflame and damage a variety of organs and tissues, including the skin, joints, kidneys, heart, lungs, brain, and blood cells. In addition to medical management, lifestyle changes can help with lupus management. Maintaining a balanced diet, getting regular exercise, managing stress, protecting the skin from sunlight, and avoiding known triggers or substances that can worsen symptoms are examples of these. We will look at 6 foods that you should be cautious about if you have lupus. Let's start with alfalfa sprouts. These sprouts are high in nutrients and provide a variety of health benefits when included in a well-balanced diet. They are high in vitamins A, C, and K, as well as minerals like calcium and iron. Individuals with autoimmune diseases, such as lupus, should use caution when consuming alfalfa sprouts. These sprouts contain an amino acid called L-carnitine, which has the potential to activate the immune system and promote inflammation, potentially worsening symptoms in lupus patients. There has been little scientific research on the specific effects of alfalfa sprouts on lupus, and responses vary between individuals. As a result, those with lupus should exercise caution and seek personalized medical advice before consuming these sprouts or supplements. After alfalfa sprouts, let's now look at foods high in sodium. Excessive sodium consumption can cause fluid retention in the body, resulting in swelling in the extremities, such as the hands and feet. Individuals with lupus who already have joint pain and swelling may find that increased fluid retention worsens these symptoms and adds to their discomfort. Lupus nephritis, an inflammation of the kidneys common in lupus, is already a concern for those suffering from the disease. High sodium intake can put additional strain on the kidneys, which regulate the levels of sodium in the body. According to this 2020 study, excessive intake of salt in the diet can worsen lupus. Excess sodium consumption can activate immune cells and promote the release of pro-inflammatory molecules, leading to an increase in systemic inflammation. Individuals with lupus are frequently advised to limit sodium intake and follow a low-sodium diet to manage symptoms and support overall health. This typically entails consuming fewer processed and packaged foods and instead opting for fresh, whole foods prepared with minimal added salt or avoiding salt altogether. With this, let's now look at why alcohol should be avoided. Alcohol is known for its ability to hinder the production of immune cells and antibodies. It has the potential to disrupt the maturation of immune cells, resulting in an imbalance among various types of immune cells. Consequently, antibody production may decrease, weakening the body's ability to combat infections. Moreover, alcohol-induced inflammation can worsen the already existing inflammation in lupus. This additional burden on the dysregulated immune system can lead to heightened disease activity and aggravated symptoms. Additionally, individuals with lupus often rely on medications such as immunosuppressants or non-steroidal anti-inflammatory drugs to manage their condition. According to an article published by Lupus Foundation of America, alcohol can have negative interactions with these medications, potentially diminishing their effectiveness or causing adverse side effects. This can impact the overall management of lupus, contributing to inflammation and disease activity. As a general guideline, individuals suffering from lupus should completely avoid alcohol. Now, let's move on to the 4th food item, garlic. Garlic is well known for its immune-boosting properties, owing to compounds such as allicin and other organosulfur compounds. These compounds stimulate the immune system by improving immune cell function and increasing the production of immune system chemical messengers known as cytokines. While these immune-stimulating effects may be beneficial to people with normal or weakened immune systems, they may aggravate symptoms in those with autoimmune diseases such as lupus. Garlic has also been shown to thin blood and may interfere with medications commonly used by lupus patients, potentially increasing the risk of bleeding. While garlic is generally considered safe for culinary use, it is important to consult with a healthcare professional or registered dietitian who is familiar with your specific health situation. Now at number 5, let's look at nightshade vegetables. Nightshade vegetables, which include tomatoes, peppers, potatoes, and eggplants, are nutritious and safe for the majority of people. Nightshade vegetables contain a variety of alkaloids that can interfere with nerve muscle function and digestion. These alkaloids may cause digestive distress or worsen inflammation in some people. Glycoalkaloids, on the other hand, are natural toxins found in vegetables such as potatoes and tomatoes. They can disrupt cell membranes and interfere with certain neurological and digestive functions in people with autoimmune diseases. It's also worth noting that the scientific evidence linking nightshade vegetables to worsen lupus symptoms is largely anecdotal. Most people with lupus can safely consume these vegetables. Individuals with lupus or other autoimmune conditions may find it beneficial to keep a food diary, documenting their meals and observing how they feel afterward. This practice can assist in pinpointing any specific food triggers that may exacerbate symptoms. Finally, let's look at saturated and trans fat. TLR4, or Toll-like receptor 4, is a component of your immune system that responds to germs and other potentially harmful substances. TLR4 has been shown in studies to be activated by saturated fat. When TLR4 is activated, your body can produce molecules known as cytokines. These molecules have the potential to cause inflammation, which is your body's way of combating things it perceives to be harmful. However, too much inflammation can be harmful to your body. Saturated fats can also make it more difficult for certain immune cells known as Treg cells to function effectively. These cells aid in the control of your immune system, preventing it from attacking your own body. As a result, eating too much saturated fat may impact the immune system. Remember that a well-balanced diet low in saturated and trans fats is essential for lupus patients. To improve your overall health, focus on whole foods, lean proteins, fruits and vegetables, and healthy fats like olive oil, avocado, nuts, and seeds. Always seek personalized advice from a healthcare professional or a registered dietitian based on your specific health needs. Please leave a comment if you or a loved one had to overcome an autoimmune disease. Give this video a thumbs up, subscribe, and click the bell icon if you found it useful. Have a good day, and I'll see you in the next video.